Welcome back to Girl Talk. We took a trip out to Monroe. We're in the Monroe Furniture Center. Later on, we have the lucky privilege to talk with Jerry, he's the owner, about what's new, what's the latest color for your kitchen. Yeah, stick around for that. Right now, though, it is October and Breast Cancer Awareness Month. And joining us right now is Julie Lombardo. She is the CEO. Can I say CEO?
She.
I like that. Of Capital Physical Therapy. Thanks for coming on Girl Talk.
Thanks for having me back.
It is Girl Talk after all.
Yeah, that's right.
All right. Tell us more about how physical therapy can help patients with breast cancer.
Yeah, so last year you had me on the show and I talked about being a breast cancer survivor, and I talked about that I've been a physical therapist for 20 years. So when I went through my care, I had 87 oncology visits that where physical therapy was never a part of or talked about. So I went on a mission the following year and I said, I am going to raise awareness about this because I'm a board certified women's health physical therapist specialist, and with that is training on the breast cancer patient. So that was very recognizable for me. So I went around the communities talking about this, advocating for women, raising awareness, and because the physical therapy being a part of the care plan for the breast cancer patient is is considered the standard of care from the American Physical Therapy Association, and it's supported by the American Cancer Society. So I spent the next year doing that.
That's great.
Yeah.
Some serious backing there,
Yeah.
which begs the question, why? What exactly is physical therapy doing to help breast cancer patients?
Well, that's great. Or a really good question, because every person that goes through breast cancer has a completely individualized plan. So some people might start with chemotherapy, where someone else might start with a surgery, some might have radiation, some may not. The care is very individualized to the person, and what a physical therapist does, we're movement specialists, so we get people back to moving correctly. So with breast cancer, the surgeries can vary widely. So some can be just of the breast, some can be of the breast and the abdomen, some can be of the back. They take back tissue and move it to become a breast. So our team in particular, we know the surgeries and the surgical approaches very well. Other things like, during radiation, during chemotherapy, cancer-related fatigue is prevalent in 80 and 90% of people that are going through those treatments. So we know that exercise is the non-drug treatment to help combat the side effects of chemotherapy and radiation cancer-related fatigue. Lymphedema, the swelling of the arm, we watch for that. In our team, we have our women's health physical therapists treat these patients because medications that people are on can have effects, they're hormonally based. So they can have effects on the pelvic floor, they can have effects on bone health, and being able for us as therapists to recognize that, and making sure our people being fully treated head to toe and restoring their lives, that's what we do.
That's so important. There's so many facets to that you are well knowledged in. That's great.
Thank you for doing what you do.
Yeah, thanks. And unfortunately, right now, I'm even guiding my mom, who was just diagnosed. So I'm answering questions for her that she would have a very hard time navigating alone. So that's where a physical therapist can kind of help you along. Like, when can I raise my arms? When can I lift my grocery bag? When can I vacuum? Those are the sorts of things that we help from a physical standpoint of, getting people's lives back.
It's just therapy.
Yeah.
Mental therapy.
It's both. It's both.
Can any physical therapist treat breast cancer?
Oh, that's a great question. So the treatment of the oncology or any cancer patient and the breast cancer patient, that's not a part of a standard curriculum in physical therapy school. So physical therapists come out of school being kind of a general physical therapist, but this is training beyond that. So I have, I can speak for our team. We have people or therapists across our team. Some are not comfortable at all treating breast cancer or oncology-related cases because they're not trained in that. Where we have specialists on our team that are.
Julie, I want to jump in because we only have a little bit of time left.
Yeah.
You've won awards in this area. Tell us about that. We have about 30 seconds left.
Okay, yeah, great, thanks. I was recognized as a Relay for Life honorary survivor and keynote speaker in 2017, and then I was recognized with the Women of Industry Award through in Business Magazine in 2017 for the innovative work that I've done with cancer rehab. And I got a personal letter from Rebecca Clayfish, the Lieutenant Governor, thanking me as a fellow survivor. So just super rewarding. But the patients and their success stories are really the best.
Really amazing, Julie.
Yeah.
That's so fantastic. Thank you for all the work that you're doing.
Yes.
If you know someone or maybe yourself dealing with breast cancer, consider meeting up with Julie Lombardo, the CEO of Capital Physical Therapy. Thanks,
Thank you.
Julie.
Thanks,
All right, we'll be right back.